Welcome to Our College, Your Voices. I'm your host, Kara Monroe. On today's episode, we're going to talk about the ever-evolving situation with COVID-19 or the coronavirus at Ivy Tech and across Indiana. We typically try to bring you episodes that are what are called evergreen, that they don't have a expiration date on them and that they're good for a really long time. But as this situation is evolving so quickly, I am going to ask you to be very mindful of the fact that we're recording this on Friday, March 20th, 2020 at 3:15 p.m. in the afternoon. We're going to do our best to get it released to you over the weekend, so March 21st or 22nd. But I'll just remind you that for the most up-to-date information about Ivy Tech's response to the COVID-19 situation, the COVID-19 pandemic, please go to www.ivytech.edu/COVID-19. Again, that's www.ivytech.edu/COVID-19. I'm very happy to have two guests with us today, and I'd like to give them a chance to introduce themselves. The first one is John Barefoot. John, welcome back to the show.
Thank you very much.
Thanks. Would you remind our listeners what your role here is at Ivy Tech?
Sure. So I lead up our statewide public safety and emergency preparedness team. And the emphasis the past couple of weeks has been on emergency preparedness.
Absolutely. We've done quite a bit of that. And our other guest this week is Sue Elsperman. Hi, Sue.
Hi, Kara, and I serve as president of Ivy Tech. It's great to be with you. Would like it to be under more cheerful times, but we're doing what needs to be done here.
Excellent. And while we are still recording, as folks who are inside of our community know, we are about to close our doors at 5 p.m. Local time here in Indy today. We are, though, recording from 3 separate rooms so that we can maintain appropriate social distance. So everybody should know we're safe as we're recording this and doing what we need to be doing. So, John, I haven't told the backstory. You and I actually recorded an episode on COVID-19 about a week and a half ago. And within the 5 days after that episode was recorded, it was so far out of date that we decided we couldn't use it. Hence why we're recording this on a Friday. But I'd still like to start this episode the same way that we started that last episode, which is to have you give an overview of some of the new terms that folks have gotten used to, like quarantine and isolation and outbreak and pandemic and all those things. So would you start with that again, please?
Yeah, so we'll give the high-level overview. So we'll start where you did with quarantine versus isolation. So what's important to remember is that we isolate sick people and we quarantine the rest to try and avoid them getting sick after an exposure. So we've heard a lot about quarantine and isolation, self-isolation, self-quarantine. The difference between self-isolation and isolation is really whether or not that isolation is taking place in a hospital, in a medical care facility, or in your own home. Quarantine, the same thing. So self-quarantine in your own home. Quarantine, we're seeing some places that are large exclusion zones or large quarantine areas being set up, and those are typically enforced by public health officials. In addition to those, we have a lot of terms around this virus. So if you think way back to mid-January, it was a novel coronavirus. And novel just meaning that we hadn't seen it before and we hadn't gotten a chance to name it yet. And coronavirus is a classification of viruses based on what they look like and how they act. And coronaviruses have been in our environment for a very long time, but this one is a new one and it's acting differently. And because it's new, nobody had any immune response already in their bodies for it. Then the novel coronavirus, we've renamed it. We've classified it more appropriately as SARS-CoV-2. So SARS being the Southern Respiratory Syndrome, CoV because it's a coronavirus, and 2 because if you remember, some of your listeners will remember, we had a SARS outbreak a few years back. So this is the second version of that. And SARS-CoV-2, the virus, leads to the disease process, COVID, and 19 is for the year that it was discovered. So all that to say that if you hear coronavirus, SARS-CoV-2, COVID-19, those are all interchangeable from a practical standpoint when you're looking at media reports, because the disease process versus the virus, a lot of folks are using those terms interchangeably. And then the last one, and this is the one that really made our last recording out of date, is the difference between an outbreak, an epidemic, and a pandemic. So an outbreak is a localized outbreak. That's a localized cluster of a particular disease that we're seeing. Epidemic would be more widespread and typically localized to an entire country, and pandemic is reserved for when we see widespread disease process across country lines and throughout the world. So the World Health Organization did classify this as a global pandemic, which means that they're seeing uncontrolled spread in various places throughout the world. So that's the down and dirty public health version of the terms that you're likely seeing in the news and in some of our Ivy Tech communications.
Excellent. So the next question to both of you, and I think maybe Sue will start with your sort of global perspective as the president, and then John maybe down into the more operational response. But I'd like for you to talk listeners through what the response process has been at the leadership and college level over the last, this has been on my radar screen since January of this year as we started to see the situation developing in China. But just sort of talk through what that global process has been for folks.
Well, I think first and foremost, it has been about the safety of our employees and our students as they were able to come on campus and be able to take classes in a quote unquote normal way, which quickly elevated to this 8 weeks, realizing a couple of weeks ago already that we were probably going to need to go to an online manner of delivery for all of our second 8 weeks, both the continuation of our 16-week courses as well as any of our new 8-week courses. And then as has happened over the last several days based on escalations by CDC, by the State Department of Health, by the governor, by local municipalities, that we realized we could no longer keep our doors open in the way we wanted to, which would be to allow our students and our own employees to come to work or come here to use our facilities, our technology, to meet with faculty, to meet with advisors. And that has escalated as of the last day, yesterday being Thursday, late afternoon, we made the announcement that we would go completely virtual as a college, meaning that in less than an hour, we will close our doors both to our employees as well as to students and others who would want to do business with us here or get support from us here. That will all go to virtual, meaning that those services in most cases will still continue, but not in the face-to-face manner that we had been accustomed to doing it here on the campus. And I'll let John add in more of the technical part of that, but I think in essence, it's been this doing what we needed to do to be safer, and progressively over the last 2 weeks having to get to the point where now really to provide the quality and the environment that is safe and appropriate to our students and our employees, we've had to go to this really full virtual approach.
Okay, yeah. So, and I can follow that up with, again, some more of the technical side of things. But I think what Sue mentioned, what you mentioned is very important, because as everybody that's received all of our public safety advisories and your messages over the last few weeks knows, we have taken a very deliberative and very incremental approach to this. And so what I want to make sure that everybody understands about how our internal processes work is that we take all of the data that's available to us from our higher ed partners, from our state health partners, county health partners, and even national partners, and then we apply that information as best we can to the risks and the exposures to us in our college and our environment. And I can liken this to, if you look state by state, we're seeing a lot of things across the country right now with different governors taking different approaches. And you're seeing some criticism publicly of that. And I think that the important thing to remember is those governors, like we did, are looking within the four walls of their state to determine what's best with the information that they have. And so as we made this incremental approach, and now it's Friday afternoon, and we've decided the best thing is to go to a completely virtual environment, the facts and circumstances changed very, very quickly over the last month, and that's led us to this decision. We were planning for this. We talk about these things, and we knew that this was a possibility, and that made the execution of that plan a little bit easier. I think that, looking out the window of the room that I'm in, still see lots of stressed people walking around. That's normal. That's okay. But we try and plan out as far as we can for what we think contingencies A through Z are going to be. And we're going to continue to do that. So even though we're working virtually, the senior leadership is going to continue to meet regularly to plan on what comes next. Because the most important thing and the fundamental concept of emergency management is that you start planning for that demobilization, so for that return to normal, at the same time that you plan for what's happening in front of you. So we're always keeping an eye on making sure that we can open our doors just as soon as it's healthy and safe to do so, and that we can do that in an orderly manner so that we can provide the services at the level that we're used to providing them and that we want to provide to our communities and to our students.
And I think, Carrie, I know you're facilitating today with this conversation, but you know that it was weeks ago when you gave faculty the heads up that we should be prepared should
Correct.
this continue to go to our virtual classes all online. And so, yes, it has been a very methodical over several number of weeks and months, but now we have felt the escalation in the last couple weeks that have really felt like a whirlwind of, wow, we knew we might have to go here, but wow, we're here. And I want to thank John, and all of our PCEP team, public safety and emergency preparedness, but I also want to thank all of our faculty, staff, and leaders across the college, because we have all had our cheese moved a lot and
Yes.
are doing things in different ways than we've ever done before. I mentioned to John, it feels like somebody threw up the deck of cards and now they're all landing in different places, and we're figuring out a new normal. And I'm so appreciative of all of our colleagues here at Ivy Tech, because they have been amazingly gracious throughout this time of tremendous uncertainty, and trusting that we are doing this in a methodical way, that we're not making it up as we go. We are using best practices. We are taking best guidance and trying to do what is best for all.
Sue, I appreciate that so much, and I echo all of your sentiments and the thanks to all of our faculty and staff who have just worked so incredibly hard. Not only did we move their cheese, but the ground is literally shifting under us as we're doing things. Sometimes in an 8:30 a.m. briefing, I'd give one update, and by 2 p.m. that was completely out the door, and we were doing something just a little bit different. So it's been a very interesting week. I'd love for the two of you to talk about a little bit about what, we've made the decision that this is definitely for 2 weeks, and then we're going to sort of watch the situation. But I know we're talking about realistically, and I hope this isn't a surprise to anyone that's listening. I don't think it will be, that 2 weeks is probably not long enough, and we will probably be in this state for a bit longer. I'd like for you to both talk a little bit about what the next steps do look like for folks, and just what they can expect over the next few weeks as we work in this new way.
Well, I'll start, and John can then add the technical part to what I say. Know that we are looking out 2 weeks plus a day. We're looking out to summer. We're even beginning to look at a horizon of fall. All of that is to be prepared for continuing in this way, maybe through the end of this term, unless things improve tremendously, which is, I'm the eternal optimist, but I'm not overly optimistic that by end of term it will be a situation where we can come back safely. But we talk about, and I'll use the term 72-hour plan here. We've talked about that we would like to be able, when it is safe, for us to begin de-escalating and coming back to at least close to the old normal, that we will be able to do that. But we will wait until we have data and clearances and confidence that we can bring people safely back. So I would expect that we will continue to provide very frequent updates, whether it's an email from me or whether it's a short video or whether it's something from chancellors or John or you as our provost. They should expect to get very regular communications from us about what is coming. And we don't have a crystal ball. but we will follow the recommendations and always putting safety in front, but with the same urgency that we want to open our doors to allow students, faculty, and staff back as soon as it is safe to do that. We know that many of our students need the services here. We know that our faculty, at least those who had planned to teach face-to-face, would have preferred to teach face-to-face with their students. And there are so many clinicals and labs that we want to be able to go back to and allow our students to complete that credential, complete the courses they're in. But until we can get that to that point of safe, we just can't make that. So the projections, as you say, are probably more than 2 weeks, but we will want to move back in, come back as soon as we can. John, add your thoughts.
Yeah, so I think just to follow up on that, one of the things that, to your point, Sue, that there is no crystal ball, but we are watching how the pandemic behaves in other countries. We as the United States and at the state and local level are learning what's effective in, as I think all of us are familiar with, and I probably should have added this to the terms I defined at the beginning of the segment, of flattening the curve. But I think something important when we flatten the curve, so that's spreading the number of infections out over a greater period of time so that we don't burden the healthcare system, that is going to spread the infection rate out over time. So that's something that we're intentionally doing because that will increase the survivability. It'll decrease the seriousness of those infections. But we're going to watch all of that across the globe in the United States, in Indiana, to try and project and prepare for when it is safe to come back. And I think it's important, too, to remember that as we're even seeing in China, that where the epicenter of this outbreak started, they are reporting no new community-borne cases. They are still reporting some cases that are imported as people are returning home. But as things dwindled there and they were able to relax some of the restrictions, there were still a couple of new cases here and there. And so I think it's important to remember, too, that it is unlikely that the determination that we're safe is going to be that the disease is completely eradicated globally. I just want to be very realistic with people that I think that coronavirus, you might continue to hear people pop up here and there for quite a while, but the spread that we're seeing within the community from person to person, that exponential growth is really what's concerning and led us to this decision. And so that's really what we're watching with our state health and local health partners to see when we see that local community spread at an exponential growth. When we see that decrease, that's when we know that we've kind of gotten over the hump and we're on our way back down. So we'll be working with Indiana State Department of Health. Now the Indiana Department of Homeland Security is also involved as a coordinating agency, and we're getting working on those information flows to make sure that we're feeding them information and vice versa, so that we can help make the best informed decision as a college as to when it makes sense to open our doors back up.
So, Sue, I'd like to ask you to just comment a little bit on the sort of overall leadership challenge that this provides for everyone, and how, and you and I have talked about this a little bit, so I'm trying to just sort of have you recount some conversations we've had about the necessity for everyone to really step up in a different kind of way, or to just embrace this situation and go there. Would you mind sharing some of the thoughts that we've talked about this week?
Well, I do think that this is a time, I know for me as a leader, this is a very challenging time to make sure that I'm, number one, a role model, that I'm projecting confidence in how we move forward, but also having high expectations of those around me. Now, I am blessed because I have a tremendous cabinet, and we have 18 amazing chancellors out there and a team at Systems Office that are totally committed. But in that, we really need every ID Tech faculty member, how they project their calm, their steadfastness during this, their commitment to students, learning new things. I'm not comfortable with Zoom and all this virtual world, but I'm going to get that there, and I'm going to embrace it. And I'm not even looking forward to spending all this time with my husband at home And he knows that, so that's not a new news. But all of us, we have to step up to this moment. And if I could just personally ask every leader, every faculty member, every staff member, anyone who serves our students and our communities, please know that this is the time that we need to be our very best selves. We need to project that calm and the caring and all the things that I know we all feel already. But I really am asking, truly asking everyone to step it up even one more level. I will expect that of myself. I hope that they will, that each of us as a community member will expect that of ourselves. And Kara, thank you for all you have done already to step up in every way. The bandwidth that I see each of us exhibiting, we all had jobs and responsibilities before, but now picture that bandwidth needing to get a lot broader to really anticipating all that's needed while doing our core role, whatever that is, but being prepared and making sure that we're doing all we can to ensure the success of our students and the success of the college.
And Sue, I echo your comments. And as I've said, I'm just trying to hold it together to 5 p.m. Because I
we
am
have talked about virtual happy hours.
Yes, there will be some virtual happy hours. Yep. But in my 22 years, almost 22 years with the college, I've never experienced a situation where we close the doors and we don't have a date that we know and we're going to reopen them. I'm going to make it through this without falling apart. But this is certainly the most unique challenge that I've ever faced. And I appreciate the opportunities and the trust you've shown in your team because you've done an excellent job. And John, I want to commend you for the work you've done because you've been outstanding. And so that I can recover emotionally, I'm going to transition to the next question here. John, is for you. I'd like you just to give an insight into, we moved into an emergency operations center mode, which is typical in crisis management situations like this, or emergency management situations, sorry, not crisis. And I'd like you to talk a little bit about the differences in an institution, how institutional decision-making changes a little bit in that. John, I'll ask you to start with that question and just sort of what the clock process of that looks like, cadence of meetings and those sorts of things. And then Sue, if you could talk a little bit more about just, we're continuing in this mode, even though we're moving to this virtual situation. We're certainly not out of the woods yet. So John, could you start with that, please?
Yeah, absolutely. So the Emergency Operations Center was activated here in Systems Office as a statewide area to collaborate, and that's really what emergency operations centers are. It's a way to bring information and resource needs and resource requests together, filter them, get answers back out, so that really when you've got that cross-functional team in the Emergency Operations Center in the EOC, instead of having to make a phone call or send an email, you can just turn to that other person and ask the question and problem solve right there. So the way that decisions are made, it mirrors the way that we would make decisions during a normal kind of day-to-day process, but it's expedited, right? So we have started meeting regularly with a modified cabinet that in emergency management terms is the executive policy group. So that executive policy group sets policy, not in the sense that we're used to, so not financial management policy or ASOM policy, but policy in Sue alluded to our 72-hour clock earlier. So that's a decision that came out of the executive policy group that said, you know what, when the time comes to open up the doors, what's the benchmark? How quickly from the time that we get word that it's safe do we want to be open and ready? And they said 72 hours. So now it's the job of those in the EOC and the functional areas to figure out what we need in order to make that happen. There's a lot of interaction between that executive policy group and the Emergency Operations Center, and in our setting, the Emergency Operations Center and our campuses. And so we mirror the state in that way. The state Emergency Operations Center interacts with the counties, and then the counties with the cities, and we've set ours up very, very similarly. So at the campus level, we're seeing cabinets meet obviously more regularly than normal. We're seeing functional huddles at the state level amongst statewide teams and then at the local level so that all this information can get shared. And in emergency management, that's called the battle rhythm. It's inherited from the military, but that battle rhythm is that cadence of meetings. So we start every morning before the Emergency Operations Center, before we have our briefing. Some members from PCEP participate in some early morning briefings. And then we have a statewide briefing at 8:30 every morning. And that cadence is going to continue. So we're going to move to a virtual EOC. We'll continue to have our 8:30 huddle. One of the to-dos this weekend is to try and coordinate all of those huddles because we have so many people that do such excellent work on many, many teams. We want to try and make sure that they can attend all of the appropriate huddles. But those huddles then give you the news of the day, what we need to accomplish that day, and any changes that may be coming. And then we start all over the next day. So that's kind of how we have set this up with our cadence, our battle rhythm. And to be frank, we'll get better at it the next time, right? So there were some stumbles at the beginning, and that is completely normal. We've been taking after action notes the entire time, and we'll figure out how to fine tune that so that the Ivy Tech method for us works in our environment and is suited to the way that that we're set up during what I call blue skies, right? So those normal days when there's not a crisis going on.
So I'll say, and this is my time to just thank John Barefoot and the PCEP team personally, because I'm not much of a battle rhythm person. I'm having to learn that real time. That's not something that I'm the unstructured problem solver. Remember, I'm the how might we person who loves to find different ways to solve the challenges we have. But John is truly expert in understanding in the crisis mode, in the emergency situations like this, how to create that battle rhythm. And we are truly blessed as a college to have someone so expert in this to help all of us. We have the talent in this college. There is no doubt. There's nothing we can't do, but we do need that rhythm of how we come together and make timely decisions and continue to operate and bring the right minds together at the right times and get that information out to everyone so they can move forward. I just want to say thanks again to our colleagues who have allowed us, to the greatest extent, have entrusted us to make those battle calls along the way. And I can say that the vast majority of emails and texts and calls I've received have been affirming to the work we've done to this point. Mm-hmm. And those that haven't been have been trying to be very constructive about, here's some things I hope you will keep in mind, the college will keep in mind as it makes decisions going forward. So again, kudos to the battle rhythm we've had, but it does need to continue. And I look forward to the blue skies somewhere out there that John talked about, because we do have every hope and intention of getting back to those blue skies.
Sue, I'll let you continue to build on the blue sky for a moment, because my top strength is learner. I know it's an important thing to you to always look to how might we, and there's no good news in this situation, but there's a lot of opportunities, and we talked about that. So I'd love for you to talk about that, and then John, I'm setting you up with that question to also talk about we're getting to live out our business continuity plan. So I'll let you close this question to talk about that, John. So Sue, to you first.
Well, yes, there is nothing about this that any of us want, but in it are opportunities to try things we've never had maybe quite the courage to try before, and yet now we find there are a few options, but to do it that way. So I know many faculty are feeling that right now. Definitely. As they've always taught in that face-to-face, and now they find themselves Monday going into an online approach. So there's always good stretch in there, and as you've seen already this week, as we've met and taken these escalations, and as we begin to look out further, I've asked that we continue to look for the opportunities here to, as we do create a new normal, let's create a new normal that may benefit the college and our students long-term, to learn, to grow, and to create. We know, I've said many times, it's not a new term, that Ivy Tech needs to be the community college Indiana needs us to be, that we need to keep changing and growing and evolving. This is giving us a chance to do that a little faster, a little more less planned than maybe we had hoped, but it also gives us a chance with some of the training wheels taken off to try to see if we can ride the bike in some new ways, knowing that even if we do, skin our knees a little bit, it will be for other good reasons to try to meet some immediate needs. And then hopefully we'll learn some skills and we'll develop some routines that will help us be much more successful when the blue skies come. And while everyone's listening to this, as our colleagues across the college have ideas on how we prepare and move towards these blue skies, if you see opportunities, please reach to your manager, to your chancellor, to one of us about your ideas that you hope we will be thinking about that could make us stronger and better and serving our students in even more successful ways going forward. I think the one example, I think I'll use yours and make sure I'm using the right term with placement. Tell me your term for it.
Knowledge assessment.
Knowledge assessment. As you know, AccuPlacer is not practical anymore to ask every student to take for placement. We're now stretching ourselves, creating new muscles to do this knowledge assessment in a way that it's absolutely the appropriate thing to do now. And we hope that it will help guide us on how to move through into the future to help assess better for our students and potential students to be successful and not scared away as some of our tools do today. So we're hopeful that this is going to help us.
John, on the last episode you were on, we just previewed business continuity plans, but you've not said "I told you so" to any of us, but this is certainly a reason to understand why those are so important. Will you talk just a little bit more about that work and the importance of it?
Yeah, absolutely. So, and that's what I was going to say is this is my opportunity to still not say "I told you so," but actually focus on the good work that's already been going on. So, business continuity planning was launched officially for the college January 1st, and it is a revamp. We, as a college, did a continuity plan at the state level, so trying to encompass all of the departments and everybody that works for the college under one plan a little over a decade ago. And so our team came together and really decided that was one of the first big projects that we wanted to tackle, because not only had the plan not been updated in over a decade, the whole theory of continuity planning had actually changed. So now we have department-based continuity plans to empower departments to reconstitute. So after a business interruption, to get back up and running at the department level. And so what that means is we have many small plans instead of one huge plan. And some campuses are nearing completion of their first round of continuity planning. So a shout out actually to the Bloomington campus. They're doing great work down there in Bloomington, and we've got some other campuses that are doing great work as well. But even the campuses that don't have completed plans have all started the process. They've all had their kickoff meetings. They've all looked at the tools that we have, and they're starting to think through those things. And so even if we had a business unit or a campus that wasn't able to take a completed plan off the shelf and execute it, we've already started to think through some of those things, and that's very, very, very helpful. I think the other thing that I found is that we had some people, I've gotten a couple of text messages and a couple of metaphorical taps on the shoulder because we're monitoring social distancing, saying, hey, when this is done, I think I need to do some updates to my continuity plan. Totally normal, right? So when we do the continuity planning, we say that they need to be updated annually or every time they're used, because as we were pitching this whole idea of business continuity planning for the college, I was asked many, many times to come up with an example of a disaster that would cause the entire college to suffer a business interruption. And I said, I don't have one for you right now, but I promise it exists. So here we are, right? And this is a business interruption. And because we've identified what our critical functions are, we know what the mission of the college is, we can focus resources there and determine the best way to continue those functions. And then in that 72-hour ramp-up period, we can start to bring back some of our other functions as well. So that business continuity work will continue. This isn't a one and done. So when we get back to business as normal, we'll dive back into to help those that haven't completed a plan yet get that done. And then we'll also keep working on those plans through tabletop exercises and discussions to start thinking through some things that are a little bit smaller scale than a global pandemic. We want to look at them as well and make sure that the departments still have that tool to use. They just have an interruption within their individual department.
Yeah, John, if I could, I'd like my next emergency to be slightly smaller than this one, if we could order
yes,
that.
That's what we're shooting for. Absolutely.
I appreciate that
motion.
Yeah. So we'll bring this episode to a close. And so I'm going to give you both just a chance. Normally I try to set this up with a question, but John, I'll give you the first chance, and then Sue, I'll give you the chance to give the last word. But any parting thoughts as we end the episode, and then I'll end with our call to action and our other items.
Sure. I just want to thank everybody for being adaptable. That's the biggest thing during crisis management, right? So there are folks in emergency management, especially in state offices, that have huge staffs for this. All they do is plan, right? They're planners. That's their job. They write beautiful plans. The execution of those plans always comes down to, when that crisis takes place, how can we take our best intentioned plan and implement it with adapting to what's in front of us? And I think that the crisis that we're working through, the pandemic that we're working through right now, is a very, very good example of that, because we have some great plans that we wrote and that we were ready to implement, that the situation changed so quickly in the span of 24 hours that we needed to move on to the next plan. So I think the big thing is just to thank you, not only to my team, so I'll echo that as well, but also to everybody that's listening for being adaptable over the last 2 months. And being able to roll with the punches, because that's the most important thing as we work through this as a college, is continuing to be able to improvise and be able to adapt as the situation continues to change.
And I want to leave everyone with just a wish for each of our colleagues' safety and health, and that they will, as you are listening, please take care of your family, your loved ones. These are extraordinary times. Take care of your own mental health. Make sure you get rest. Do the things that help feed you and keep you well settled, well grounded. And know that the college will be here for you. We'll be virtual. We'll see each other across screens or over the telephone, but please know that we care about each and every one of you, just as we care about each and one of our students. And I personally wish you well and look forward to those blue skies at the end of this pandemic.
Excellent. Well, I will end this episode with a call to action, as we always do. I'm going to remind you, just like I did at the top of the show, please keep referring to our website, www.ivtech.edu/COVID-19. That's www.ivtech.edu/COVID-19. And I want to echo Sue's comments. Stay healthy and be safe, because we do want to see you back as quickly as possible. And we are very anxious to get our doors back open to our students and our communities who need us so very much. Thank you to everybody for joining this episode of Our College, Your Voices. I want to thank our panel members, John Barefoot, our Assistant Vice President for Public Safety and Emergency Planning, and Dr. Sue Osperman, the President here at Ivy Tech. Thank you both so much. I'm your host, Kara Monroe. You can connect with me on Twitter at KNMTweets. You can reach us by email at ourcollegeyourvoices@ivtech.edu. And just in case you're wondering, we are still going to be putting out a full schedule of episodes. This doesn't change anything about that. We are demonstrating today that we can make an episode and not be together. Quality might be a little different than you're used to, but we are still going to be here for you through this entire situation. You can leave us a voicemail at 317-572-5049. For our employees, you can join our Microsoft Teams listener community. Just go into Microsoft Teams. You can do that either through your desktop app or through My Ivy, and going to the Office 365 icon, click on Join a Teams, and then I think you have to search for Our College, Your Voices, and you can join that team. Our website is ivytech.edu/podcast. Production assistance for this episode is provided by Becky Campbell and Sarah Ferguson. Our podcast concept is by Matthew Pittman. Our theme music and our post-production services for this episode provided by the incredibly talented Jen Eads at the Brassy Broadcasting Company, who's going to help us make sure we keep bringing you episodes on a regular schedule. And we will talk to you very soon again on Our College, Your Voices.